All right, welcome back everyone to the deep dive. We're jumping into something a little different today.
Definitely different.
Yeah, we're diving into the world of emergency medicine,
Ooh, exciting.
and specifically um, how paramedics approach a situation that's, yeah, every second counts, right?
Yep.
Someone with what's called an altered level of consciousness.
Yeah.
And this isn't just someone who's like asleep, right? This is someone who, maybe is deeply confused, can't be woken up, or just acting completely out of character.
Right. Totally.
So we've got an actual guideline that paramedics use
Mhm.
to kind of break down, like, what do they do first? What are they thinking when they arrive on scene?
Yeah, it's really
It's a
interesting.
medical mystery.
Like a detective story almost.
Exactly.
With a patient where the clues are there, they're just hidden.
They're in the body.
Exactly.
So when a paramedic arrives at a scene like this, what's the very first thing? Where do they even begin?
Well, I think the first thing is trying to figure out why this person is unresponsive, right? So, is it a head injury? Is it a stroke? Is it a drug overdose? The possibilities really kind of endless.
So many things. It could be.
So many things, and the guideline helps them kind of navigate that maze.
Gives them a framework.
Exactly. It gives them a systematic approach
Okay.
to quickly assess the situation because it's not one size fits all.
Right.
Each cause requires a completely different response, so they have to think on their feet.
Yeah, and fast.
Yeah, absolutely.
So is it like having like a mental checklist they're running through in their head?
I think it is, and one of the things they use is what's called the AVPU scale, which stands
Yeah.
for alert, verbal, pain, unresponsive.
Okay.
And so that quickly and easily allows them to kind of gauge the level of consciousness.
Assess the situation.
Exactly.
So then the guideline also mentions this secondary survey. What in the world is that?
Think of it as a head-to-toe detective search for clues, right?
Okay.
Like Sherlock Holmes, but on a patient. So they're trained to look for anything and everything.
Literally anything.
Yeah.
Okay.
Are there any visible injuries like bruises or cuts? Are the pupils pinpoint which might suggest like an opioid overdose? Or are they unequal, which might suggest like a brain bleed?
Oh, wow.
Do they have a medical alert bracelet, something that indicates like they have diabetes?
Oh, I see.
So it's literally any detail, no matter how small, could be a vital clue
Wow.
to what's actually going on.
It's fascinating to me. Like, I'm imagining like being that paramedic, and it's like high pressure.
Extremely.
It's chaos. There's like family members, there's bystanders, and you're trying to gather all this information.
Yeah, and also just the environment you're in, right? You could be in a really dangerous environment.
Okay, point.
Or, it could be weather.
Yeah.
And then the pressure of knowing that, this person's life is potentially in your hands
Right. Wow.
makes it really difficult.
Yeah. What's something that like makes it particularly challenging about, these situations?
Well, the symptoms can be super misleading,
Okay.
right? Like you could have someone who's unresponsive and it's because they fainted,
Right.
or they could be unresponsive because they're having a heart attack.
Oh, wow.
And so it's really a constant process of evaluation,
Right.
reevaluation, and adapting.
Okay, so now we're gathering all these clues from the body, but this guideline also talks about, considering trauma.
Yes.
Even if you can't see it, why is that so important?
Well, trauma can be hidden, right? Like, let's say someone's involved in a car accident.
Okay.
They might seem okay at first, but then become disoriented or even lose consciousness later on.
Oh, wow.
And so that could be a sign of internal bleeding or a concussion,
Sure.
things that aren't always immediately obvious.
So it's like even if someone doesn't have like a gash on their head, you
Exactly.
might still suspect a head injury.
Exactly. You're looking for those subtle signs,
Okay.
changes in behavior, slurred speech, anything that's just kind of out of the ordinary.
Wow, fascinating. So the guideline also stresses two crucial actions: airway management and ventilation.
Uh-huh.
Why are those so critical?
Well, because every cell in the body needs oxygen to function, right?
Makes sense.
When someone stops breathing effectively, it's like cutting off the power supply.
Oh, wow. Yeah.
Their brain, their heart, everything starts shutting down.
Okay.
So paramedics really focus on getting that airway open and ensuring that they're breathing, that they're getting enough oxygen.
Yeah.
And they do this by using techniques like tilting the head back or inserting a breathing tube, or they might use a device called a bag valve mask to help them breathe.
And this is all happening like as quickly as possible.
Yeah, literally every second counts in these situations. It's
Mhm.
pretty incredible what they do.
Yeah. Talk about high stakes.
Right.
So it seems like the key takeaway here is that responding to someone with altered level of consciousness, it's all about It's rapid assessment,
Uh,
figuring out the cause, taking immediate action to stabilize them.
exactly.
But this is just the beginning, right?
Yeah. Yeah, this is just the pre-hospital setting.
So what happens after the paramedics get that person to the hospital?
Right. What do the doctors do to kind of continue that investigation?
Right,
Determine what the best treatment is?
right. So much more to uncover.
Yeah, so much more.
It really leaves us with a lot to think about.
It really does.
And that's a wrap for today's deep dive into the world of emergency medicine. So thanks for joining us.
Thanks for having me.
We'll see you next time.
See ya.
Okay, so today we're going to be doing a deep dive into something I think is going to be really interesting.
Oh, yeah.
Yeah, so we're going to be looking at IV maintenance,
Mm-hmm.
but specifically, during patient transport.
Right.
And what's so cool about this deep dive is we're actually going to be looking at excerpts from like a real paramedic training manual.
Cool.
Yeah. So we're going to get to see behind the scenes,
Right.
And I think that's what's so great about these deep dives. We get to look at the stuff that, most people would never even know about, let alone get to read,
Yeah, absolutely.
So let's jump right in.
Okay.
All right. So the manual starts off with this like general directive.
Okay.
And it talks about, keeping the vein open, fluid replacement, and they really emphasize using isotonic solutions.
Yeah.
Can you talk a little bit about that? Like, why is that so important, the isotonic solutions?
Well, to put kind of simply, if you think about like the cells in your body, right? Like little water balloons. If you put them in plain water, they're going to, swell up, they might burst.
Oh, wow. Okay.
Right. But isotonic solutions, they have the same salt concentration as our cells.
Oh, okay.
So it's like they prevent those like dangerous fluid shifts. Using the wrong solution could really damage those cells, maybe disrupt organ function.
Okay, that makes a lot of sense. Wow. It's way more crucial than I even realized. And then it goes on to talk about, there's different flow rates for kids, adults, and then also like a maximum rate based on weight, which is interesting.
Yeah.
What's the reason behind all that?
It's about safety, really. I mean,
Right.
think about it like this. If you take a pitcher of water and you pour it into a glass too quickly, what
It hits the
happens? Exactly.
What's the mass?
Same thing can happen with IV fluids, right?
Yeah.
Too much, too fast, overwhelms the system.
Right.
Especially people with heart problems, kidney problems. It's like this delicate balance,
Right.
providing enough fluid without causing more harm.
Right. Yeah. No, that makes a lot of sense. And then it goes on, it lists like all the different things they can add to the IV solution.
Oh, yeah.
Like thiamine, multivitamins, certain drugs,
Oh, right. Yeah.
It's like a custom cocktail, but like for health.
Right. Exactly. It's all about tailoring it to that specific patient's needs.
Right.
Like, for instance, thiamine.
Right.
That's for people who might have, a deficiency. And then, of course, multivitamins for overall support.
Okay.
Now, then there's potassium chloride.
Right.
But, that one comes with, like, age restrictions.
Oh, okay. Why is that? Why the caution there, especially for younger patients?
Well, potassium is super important for your heart to beat properly.
Okay, yeah.
But if you give too much or too quickly, it can disrupt that rhythm. And, in children especially, the systems are still developing. It's a powerful tool, but you've got to handle it really carefully.
Right. So this next section, use of escorts, totally threw me for a loop.
Oh,
Like paramedics need backup sometimes. What's that all about?
well, paramedics, they have like different levels of certification. It's kind of like, ranks or something.
Right. Yeah. Yeah.
And certain procedures require specialized training.
Oh,
So not every paramedic can do everything.
gotcha. Okay, so an escort's kind of like calling in a specialist.
Exactly.
But in this case, they ride along.
Exactly.
It's so cool. So it mentions like, blood transfusions, potassium chloride for kids, meds beyond their certification, specialized equipment, even like those tiny patients, like neonates. It's
Yeah.
like a whole mobile medical team.
Yeah, that's a great way to put it.
That's really cool. So now let's get into the actual procedures.
Okay, sounds good.
So this pre-transport checklist, man, it's so detailed.
Yeah.
It's like confirming the doctor's order, the IV site, the fluid levels.
Yeah, it's a lot.
It's a lot. It makes me exhausted just reading it.
But, meticulous preparation is absolutely key.
Right.
Like think about like a pilot doing their pre-flight checks.
Yeah.
Everything's got to be double checked, documented thoroughly, ready to go.
Yeah.
Any little oversight could have, serious consequences during transport.
Yeah, no, it makes you really appreciate the responsibility that they carry. And then once they're on the move, it's like there's a whole other set of challenges, right?
No, for sure.
It's like bumps in the road,
Yeah.
patients shifting around. What if the IV catheter gets dislodged? Like, what happens then?
Well, paramedics, they're trained to handle those situations. They use something called aseptic technique.
Okay.
It's basically like procedures to prevent infection. So think of it like, when a surgeon's doing an operation,
Yeah.
they're trying to keep everything sterile.
Right.
So they'll secure the IV, make sure there's no bleeding, and they document every single step,
Wow.
even if they have to remove the IV entirely.
Wow. Okay, so they really have to think on their feet. This last guideline, this is kind of intriguing. Like, changing the IV bags when there's still about 150 ml left.
Oh, yeah.
Why not just run it dry? Like, what's the thinking behind that?
Well, remember we were talking about those isotonic solutions?
Right, yeah.
As the bag gets emptied, the pressure changes.
Okay.
And if it gets too low, air could get sucked into the line.
Oh.
And you don't want that because air bubbles in the bloodstream, not good.
Right, yeah.
So they change it early to make sure there's a continuous flow.
Oh, okay. So it's like swapping out a propane tank, before the grill goes out, it got to keep things flowing.
Exactly.
Wow. It's amazing how much thought goes into IV maintenance. It seems so simple, but it's really all about patient safety.
It really is, every step of the way.
Yeah. And, after this deep dive, I'm looking at IVs in a whole new light. It makes you wonder, consider all these procedures, all these safeguards. What questions would you ask a paramedic if they were setting up an IV for you or for a loved one? So think about that as you head back out into the world, folks. And we'll catch you next time for another deep dive.
See you then.
Hey, everyone. Welcome back. Ready to dive deep into something kind of interesting.
Always. What do we have today?
Well, we're going to tackle extremity pain.
Okay, like arm pain, leg pain, that sort of thing.
Exactly. But here's the twist. Not from like a fall or a direct injury, more like those mysterious aches, the ones that just kind of pop up.
Oh, I think we've all been there. Sudden pain, and you're thinking, where did that come from?
Yep. And we're going to try to decode those pains.
Sounds tricky. Where are we getting our info from this time?
From, get this, paramedic guidelines.
Paramedics? Really? I never would have thought of that.
Yeah, I know, right? But think about it. They see this stuff all the time out in the field. They got to figure out what's going on fast.
That's true. They don't have the luxury of time for tests and scans like in a hospital.
Exactly.
Yeah.
So their approach can be really insightful, even if you're not, riding in an ambulance.
Okay, so pretend I'm paramedic then. Someone's complaining of leg pain, no obvious injury. What's the first thing on my mind?
Well, first, you got to think worst case scenario. Could this be life-threatening, limb-threatening? Could it impact, like, basic function?
Whoa, right off the bat, serious stuff.
Yeah, because it's about ruling out those hidden dangers before anything else.
Hidden dangers, what, like a blood clot?
That's one. It's called a vascular occlusion. Basically a blockage in a blood vessel. It can happen anywhere, like in the leg itself, or even higher up in the abdomen or chest. And, if blood flow isn't restored quickly, it can be serious.
Wow, yeah, you don't want to mess around with that. What else?
Well, there's something called acute spinal nerve root compression.
Okay, break that down for me. What does that even mean?
It's basically when a nerve coming out of your spine gets pinched.
Ouch. I can imagine that'd be pretty painful.
Oh, yeah. And the pain can radiate down your leg, making you think it's a leg problem when it actually starts in your back.
Trippy. So how do you tell the difference, like as a paramedic on scene?
Well, that's where the secondary survey comes in. It's like their detective work.
Oh, tell me more about the secondary survey.
Okay, so first they'd compare the affected leg to the unaffected one. They're looking for any differences, like is one leg colder, weaker pulse, different color?
Makes sense. So like if my left leg is ice cold and my right leg is normal, that'd be a bad sign.
Definitely a red flag.
Yeah.
Then they check what we call CSM, circulation, sensation, and movement.
CSM. All right, so what are we looking for there?
Well, with circulation, they're making sure blood is flowing properly. Sensation means checking if you can feel touch, temperature, that kind of thing. And movement is, can you wiggle your toes, move your ankle, all that.
Okay, so they're kind of painting a picture of how well everything's working down there.
Yep. And they'll examine the skin, too. Any changes in color, temperature, or condition. Is it dry, sweaty, anything unusual?
Wow, it's amazing how much info you can get just from looking, huh?
Right. It's like their way of gathering clues.
Got it. So it's all about those subtle signs. What about obvious stuff? Like swelling or a weird shape to the leg?
Oh, definitely. They'll absolutely note things like swelling, deformity, and tenderness. That all helps figure out what's going on and how serious it is. You mentioned minimizing movement earlier. Why is that so important, even before you know what's causing the pain?
Well, it goes back to that idea of not making things worse. Like, if you suspect a sprain, you wouldn't want to move it around a lot.
Right. Wouldn't want to make the injury worse.
Hmm.
Makes sense.
Exactly. Same principle here. It's always best to err on the side of caution until you know what you're dealing with.
So like classic Rice protocol.
Yeah.
Rest, ice, compression, elevation.
Yeah, exactly. Though I should say, rice might not be appropriate for every situation.
Good point. It's more about that general idea of protecting the injured area.
Right. Protect the extremity from further injury, minimize the risk.
Now, I'm sure some folks listening are thinking, wait, I'm not a paramedic. Am I supposed to do a whole secondary survey on myself every time my leg hurts?
Haha, no, definitely not. We're not expecting anyone to become a medical professional overnight, but
But
yeah.
there's a takeaway here, right?
Absolutely. You can apply the same observational skills, compare your limbs, check for temperature differences, feel for your pulses.
Right. Assess your own circulation, sensation, movement.
Right.
We can all do those things.
Exactly. It's all about being in tune with your body, noticing those subtle changes. You don't have to self-diagnose, but you can definitely get a sense of when something feels truly off.
And that's when you call the doctor, right?
Exactly. Sometimes those aches and pains are just, part of life, but sometimes they can be a sign of something more serious. Better to be safe than sorry.
So the message here is pay attention to your body. Don't ignore those weird pains. Compare, observe, and if something feels wrong, get it checked out.
Couldn't have said it better myself. And honestly, just that awareness, that curiosity about your body's signals, that's a huge step towards taking better care of yourself.
Totally agree. Now, before we wrap up, gotta ask, what's the most surprising thing you've learned about extremity pain? Something most people wouldn't expect.
Good question. I'd say it's how often the root cause is actually somewhere else entirely.
What do you mean?
Well, you might be focused on, say, your leg pain, but the real issue could be in your back, your hip, even your abdomen.
Whoa.
Yeah.
But how?
The body's a complex system. Pain signals can be tricky like that. They can travel, radiate, make you feel pain in one place when the problem originates somewhere completely different.
Mind blown. That's crazy.
It is. But it's also fascinating, right?
Totally. All right, folks. So next time you have that unexplained pain, remember what we learned today. Channel your inner paramedic, do a little self-assessment, and if needed, definitely reach out to a healthcare professional.
Stay curious, stay aware, and keep exploring.
And we'll catch you on our next deep dive. All right, listeners, ready for another deep dive?
Always up for a good deep dive.
Okay, good. Because this one's pretty intense.
Okay, bring it on.
Today we're going to be looking at those load-and-go decisions that paramedics have to make.
You mean like when it's life or death?
Exactly. You know, sometimes every second counts.
Right.
And they have to decide right then and there.
Do we treat them here or get them to a hospital?
Yeah, do we scoop them and run, or do we have to
Exactly.
do some stuff first?
Yeah, stabilize right there.
Right.
The scene.
Yeah.
Yeah.
So to kind of unpack this whole thing,
Okay.
we've got an excerpt here from a real load-and-go patient standard directive.
Oh, wow. Straight from the source.
Yeah, and this stuff gets pretty in-depth.
I bet.
But before we jump into the weeds here,
Okay.
can you give us the big picture?
Sure.
Like, what even is a load-and-go standard, and why is it such a big deal?
So load and go, like you said, it's all about those split-second decisions that paramedics have to make when they arrive on the scene.
Right.
They've got to assess the situation, figure out how critical the patient is, and then decide what's going to give them the best chance of survival.
Right, and sometimes that's
And sometimes that means,
get them to the hospital no matter what.
yeah, just go, go, go.
Right.
Lights and sirens, the whole 9 yards.
Yeah. So I'm guessing there's some pretty clear guidelines in this directive, right?
Oh, yeah, absolutely. It's their roadmap,
Yeah.
keeps everyone on the same page.
So, I mean, it can't be all black and white, though, right?
Of course not. Every situation is going to be a clear-cut load and go.
Right.
There are definitely those gray areas where
Right.
you got to think on your feet.
So let's dive into this directive.
Okay.
First thing I'm seeing is that it says in most cases,
Okay.
paramedics should prioritize rapid transport.
Right. Get them to the hospital ASAP.
But then there's this little phrase,
Ah.
subject to paragraph 2 below.
Ooh, sound like there's more to the story.
Yeah, what's going on in paragraph 2?
We're going to get there.
Okay.
All right.
All right, so for now, let's focus on those load-and-go situations.
Okay, sounds good.
Right off the bat, we see CTAS 1 patients.
Right. Those are the top priority folks.
CTAS 1.
Yeah.
What does that even mean?
So CTAS stands for the Canadian Triage and Acuity Scale.
Okay.
It's basically a system for ranking how sick or injured someone is,
Okay.
one being the most severe.
Oh, so a CTAS-1 patient.
They need immediate attention, no question about it.
Okay, so like what kind of situations would be a CTAS-1?
Well, you're talking major trauma, cardiac arrest,
Okay.
severe difficulty breathing, things that are immediately life-threatening.
Wow, so they've got to get moving right away.
Every second counts with a CTAS-1 patient.
So just to clarify for our listeners,
Sure.
CTAS-1, get them to the hospital now.
No time to waste.
Okay, so what else falls under this whole like
Load and go.
load and go umbrella? Yeah.
Another important one is bypass protocols.
Okay, what's that?
So let's say you have a patient who's had a major stroke.
Okay,
The closest hospital might not have the specialized resources to treat them properly.
right.
In that case, paramedics might decide to bypass that hospital
Okay.
and take them directly to a stroke center, even if it's a bit farther away.
So it's not always about getting to the closest hospital.
Exactly. It's about getting to the right hospital.
Okay, that makes sense.
Because sometimes those extra minutes on the road
Yeah.
can save a life in the long run.
Wow. So paramedics have to make that call on the spot.
It's a judgment call, but they're trained for it.
That's some serious pressure.
It's all part of the job.
And then there's a whole section here on obstetrical emergencies.
Oh, yeah, those can be tricky.
So like what kind of stuff are we talking about here?
We're talking eclampsia,
Okay.
premature labor, umbilical cord prolapse.
And these all require...
These are all situations where you need to get both the mother and the baby to the hospital as fast as humanly possible.
Yeah. So like
No messing around.
no time to waste.
Yeah,
Okay, so we've covered a lot of ground here.
we
I've
have.
talked about those like urgent get to the hospital now situations.
Right, the bread and butter of load and go.
But remember that mysterious paragraph too?
Oh, yeah, the plot thickens.
What are the exceptions to the load and go rule?
Okay, so this is where things get a little bit more complicated.
Okay.
Sometimes, even though a patient is in critical condition,
Yeah.
there are certain things you need to do before you can transport them.
Like what?
Well, let's take cardiac arrest, for example.
Okay.
Sometimes, despite everyone's best efforts, resuscitation attempts just aren't working.
Oh, wow.
In those cases, paramedics might have to make the very difficult decision to terminate resuscitation.
I can't imagine having to make that kind of call.
Yeah, it's a heavy burden, but sometimes it's the right call.
So are there like specific guidelines for when to terminate resuscitation?
Absolutely. There are strict protocols and ethical guidelines in place to make sure that decision is made appropriately.
So is all that laid out in this load and go standard?
Not in that specific document, no.
Okay.
But paramedics have other resources,
So-
like the Advanced Life Support Patient Care Standards,
ALS, PCS.
ALS-PCS.
Yeah.
What's that all about? Those standards provide detailed instructions on how to manage all sorts of emergencies,
Okay.
including those really tough situations like terminating resuscitation.
So it sounds like paramedics have a lot of support.
They do. They have a whole network of resources and protocols to guide them.
That's good to hear.
Yeah, it's a challenging job, but they're well equipped.
Right. And it's not just about cardiac arrest, right?
Right. There are other situations where you might need to intervene on scene before you can transport a patient.
Okay, like what?
Think severe bleeding airway obstruction.
Okay, so basically...
Those things need to be addressed immediately
Right.
before you can safely move the patient.
Stabilize, then transport.
Exactly.
Now, there's one more exception listed here.
Yeah.
That I'm kind of curious about.
What's that?
Imminent delivery.
Oh, yeah. That's a whole other ballgame.
I mean, can you imagine delivering a baby in the back of an ambulance?
It's not ideal, but sometimes it's the only option.
Wow. So paramedics have to be ready for anything.
They do. They're like the ultimate multitaskers.
So if a baby's about to be born
Yeah.
right there on the scene,
Well, then obviously delivering the baby safely takes priority over getting to the hospital immediately.
right, because you can't...
So you can't exactly put a pause on labor.
Right.
Babies come when they're ready.
So it's amazing how adaptable paramedics have to be.
They're incredible. They deal with so much variety in their work.
Yeah, and this whole load and go standard,
Yeah.
it really highlights how much goes into their decision making.
It's not just about speed.
Right.
It's about that constant assessment and reassessment.
Right. Finding that balance between
Finding that balance between...
speed
Yeah,
and giving the patient the care they need right away.
exactly. It's
Yeah.
a real balancing act.
All those split-second decisions they have to make.
They can literally make the difference between life and death.
Yeah. Wow.
It's pretty remarkable.
Makes you wonder, though, with all the technology we have these days.
Yeah, like what about telemedicine?
Exactly. How is that going to change the whole load and go landscape?
That's a good question.
Yeah, it's something to think about.
Yeah, for sure.
Well, that's all the time we have for today's deep dive.
Wow, that went by fast.
Yeah, it really did. Thanks so much for joining us.
My pleasure.
And listeners, if you found this deep dive interesting
Yeah,
and you want to hear more,
definitely let us know.
yeah, send us your suggestions and we'll see what we can dig up.
Always looking for new topics to explore.
All right, until next time,
Stay
stay curious, everyone.
Stay curious.
All right, buckle up, everyone, because today we're diving headfirst into the world of emergency medicine.
Oh yeah, we're going deep.
And I mean, seriously deep. We're talking about those heart-stopping moments when someone's experiencing some serious bleeding, like vomiting blood or, seeing bright red blood in their, wow.
It's definitely not for the faint of heart.
Right. But here's the thing. Even if you're not a doctor or a paramedic, understanding these protocols, the ones paramedics use, it can actually be super helpful in a crisis.
It really can. Knowing even a little bit can help you stay calm and give better information to the first responders if, God forbid, you ever find yourself in that situation.
Exactly. Knowledge is power, right?
Mm.
So today we're unpacking the guidelines paramedics follow when they encounter those two scary situations. What do they call them? Hematemesis?
And hematochezia.
Hematemesis and hematochezia. Those are two words you hope you never have to use in real life.
Yeah, I mean, they basically mean vomiting blood and bright red blood in the stool. Heavy stuff. Seriously heavy. And the source material we're looking at today really highlights that that time is absolutely critical in these situations.
Oh, absolutely. There's no time to waste. These guidelines are all about speed and efficiency, helping paramedics quickly assess how serious the bleeding is, figure out what's causing it, and get the patient the right care fast.
And one of the potential causes that really caught my eye, it mentioned something called esophageal varices.
Oh, yeah, those are nasty.
So what exactly are they? I mean, the name itself sounds pretty intimidating.
Well, imagine the esophagus, right? The tube that connects your mouth to your stomach. Now, picture the veins in that tube getting all swollen and bulging. That's basically what esophageal varices are.
Okay, I'm picturing it and it doesn't look good.
No, it's not good at all. These varices usually develop when there's a blockage in the blood flow to the liver, often because of liver disease. That blockage causes pressure to build up in the veins, and they basically become like these fragile balloons ready to burst.
Oh, think of it like a garden hose with a kink in it. The pressure builds up behind that kink, right? It's similar with these blood vessels. And just like a hose under too much pressure, these varices can rupture and cause massive internal bleeding.
That's a pretty vivid and scary analogy.
It's definitely a serious situation.
And then the source also mentions, gastrointestinal diseases as another potential culprit for severe bleeding. What kind of conditions are we talking about there?
Well, gastrointestinal diseases, that's kind of a broad term. It covers a whole range of problems that can affect any part of your digestive system, from the stomach all the way down to the intestines.
Right. So, give me some examples.
Sure, we're talking things like ulcers, those painful sores that can develop in the lining of your stomach or intestines, or inflammatory bowel diseases like Crohn's disease or ulcerative colitis. Even cancer can cause bleeding in the GI tract.
Wow. So it's like a whole bunch of potential suspects.
Exactly, and each of these conditions can cause bleeding in different ways with different levels of severity. So it's like a puzzle for paramedics to figure out.
So how do they even begin to, sort through all of this when they show up at a scene? I mean, it sounds pretty overwhelming.
Well, the guidelines give them a clear roadmap, a systematic approach. First, they have to figure out where the bleeding is coming from, right? So they'll assess either the patient's chest or their abdomen, depending on the type of bleeding.
So chest, it seems like it might be something like a heart or lung issue, and abdomen if it's more likely related to stomach, intestines, that sort of thing.
Yeah, exactly. It's all about narrowing down the possibilities as quickly as possible. And while they're doing that, they also have to figure out how much blood the patient has already lost.
And I was reading that they look at all sorts of things to try to determine that, right? Like how long the bleeding's been going on, if there are any clots, even like how many towels or whatever have been soaked with blood. It's kind of like they're playing detective.
Oh, for sure. They're looking for every clue they can get. Those details are super important because they can help estimate the blood loss and how urgent the situation is. If someone's lost a lot of blood in a short amount of time, that can be life-threatening.
Absolutely.
Yeah.
And speaking of clues, the guidelines use some very specific terms to describe different types of bleeding. I mean, terms that you wouldn't hear in everyday conversation, like coffee grounds emesis or melena. Can you break those down for us? What do those words actually tell paramedics about what's happening inside the body?
Yeah, those terms might sound strange, but they're like a code, you know? Each one gives paramedics a clue about where the bleeding might be coming from. So, coffee grounds emesis, that's when the vomit looks like, well, like coffee grounds.
Okay, not a pleasant image.
Definitely not. But what it tells us is that the bleeding is probably coming from somewhere in the upper digestive tract, most likely the stomach.
Makes sense. And what about melena?
Melena, that's when the stool is dark, almost black, and tarry. That's a sign that the bleeding is happening higher up in the digestive system.
And how is that different from hematochezia, the bright red blood we talked about earlier?
Right, so hematochezia usually means the bleeding is happening further down in the digestive tract, maybe in the colon or rectum, because the blood hasn't had time to get digested and turn that dark color.
Okay, so it's all about connecting the dots, using those visual clues to figure out where the problem's originating.
Exactly. It's like putting together a puzzle, but with, really high stakes.
No kidding. So, I mean, with all of these different possibilities and the pressure of time, what would you say are some of the biggest challenges that paramedics face when they're trying to, like, assess these bleeding situations?
Honestly, one of the toughest things is getting reliable information from the patient themselves. You got to remember, these people are in pain. They might be scared, confused, disoriented. They might not be able to communicate clearly what's going on.
Right. Or even if they can talk, the information they give might not be totally accurate.
Right,
Right.
absolutely. So paramedics have to be like master detectives,
Uh-huh.
They got to be able to read between the lines, interpret what they're seeing and hearing, even when the information's jumbled or incomplete.
It's pretty amazing. I mean, the kind of decisions they have to make under that kind of pressure,
Yeah.
and all while they're also trying to stabilize the patient and get them to a hospital fast.
Oh, yeah, it's high pressure for sure. And then you've got the environment to factor in, too. It's not always a nice, calm, well-lit situation. They could be dealing with a chaotic scene, bad weather, maybe they have limited resources. It takes a very special kind of person to stay cool and collected and compassionate in those situations.
Totally agree. It's like we all hope we're never in this kind of situation, but even just having like a basic grasp of these concepts, it could be so helpful if we ever need to help someone who's experiencing severe bleeding.
100%. Like, even if you're not a medical professional, you can be an extra set of eyes and ears for the paramedics. If you can describe what you're seeing accurately, that can save precious time.
Absolutely. Of course, the most important thing is to get professional medical help right away.
Yeah.
Don't try to play doctor at home, folks.
Yeah. Call 911. That's the first and most important step.
Definitely. Well, this deep dive has been fascinating. It's a little bit intense. It really makes you appreciate the incredible work that paramedics do.
It really does. They're true heroes.
As we wrap up, I'm left with one final question, something to ponder. The guidelines mentioned hemoptysis, that's coughing up blood, but they didn't really go into detail. Now, what could cause that? And how would those situations be handled differently? Something to think about. Thanks for joining us on this journey, folks. Stay safe out there. Ever get that, like, nagging abdominal pain? The kind that makes you think, should I just tough this out, or is this, like, an ER trip?
Oh, totally. It's tough to know sometimes, right?
Yeah, so today we're diving deep into abdominal pain. But not the usual, I ate too much pizza kind of thing. We're talking about the more serious stuff.
The stuff that can really, put you in a bad spot.
Exactly. And we're doing it with some pretty cool insider knowledge from, get this, a paramedic's guide. Like a real guide that paramedics use to assess non-traumatic abdominal pain.
So basically, we're getting a peek behind the curtain at how first responders actually figure out what's going on.
Exactly. And by the end of this, you'll have a way better idea of what those red flags are, the really serious stuff, and maybe even a little bit of what paramedics are actually looking for when they show up.
Yeah, they're not just there to give you a ride to the hospital. They're already starting to assess and figure things out.
Right. Okay. So let's say you're a paramedic, right? You arrive on scene, someone's got abdominal pain. What are those immediate, like, top of mind concerns? What are you thinking about first?
Well, the absolute first thing is what we call life-limb function threats. Like, that's the top priority.
Life, limb, function. Okay, so we're talking serious stuff here.
Yeah, these are conditions that need immediate action. They can be, like, incredibly dangerous if you don't catch them early.
So, like, super high stakes.
Totally. So the paramedics are trying to prioritize, like, what needs attention right now.
Got it. Okay, so walk us through some of those those top priorities then. What are some specific examples of those life limb function threats we're talking about?
Okay, so imagine a garden hose
Okay, garden hose. Got it.
with a weak spot that, like, bulges out.
Yeah, I've seen that.
That's what an aneurysm is, essentially.
Oh, okay.
Now, picture that happening in your aorta. That's the main pipeline for blood in your body.
Okay, so not good if there's a bulge there.
Right. So if that bulge, the aneurysm, bursts, you have massive internal bleeding.
Oh, yeah.
And that's why a leaking or ruptured abdominal aortic aneurysm is like at the very, very top of the list.
Oh, yeah. I'm starting to get why abdominal pain, it's not something to mess around with.
No, it's definitely not always just a simple stomach ache.
So speaking of aneurysms, when paramedics come, they always press on your stomach.
Mm.
What are they doing there? It seems like just a routine check, but are they looking for something specific?
Oh, they're definitely looking for something specific. And one of those things is, what we just talked about, a pulsatile mass.
Pulsatile mass.
Yeah. So if they're feeling around and they feel this kind of like pulsating thing, that could be a sign of an aneurysm. And then another big red flag is if your abdomen is like rock hard.
Rock hard, okay.
That could mean something called peritonitis, which is inflammation of the lining of your abdomen. That's pretty serious.
Wow, okay. I'm starting to realize that there's a lot more to that pressing on the stomach than I thought.
Yeah, it's not just a random check. They're getting vital clues about what's going on inside.
Right. And so besides aneurysms, what are some other, I guess, maybe less obvious conditions that paramedics are also trained to look for when they see abdominal pain?
Okay, so there's a whole bunch. There's ectopic pregnancy, which is where the fertilized egg implants outside the uterus.
Right.
And there's things like testicular torsion or a strangulated hernia. These are all things where, time is really of the essence.
Oh, wow.
Because you get lack of blood flow, and that can quickly cause damage.
Got it. So a lot of different possibilities. And I'm assuming they can't, immediately run tests for all those things out in the field, right?
Yeah.
So how do they go about figuring out, which direction to go? It's like a detective process almost, right?
Absolutely. It's like detective work. So once they've kind of ruled out those immediate life threats, they do a more detailed assessment.
Okay.
And it's actually really interesting how much they can deduce just from looking.
Oh, yeah.
Yeah, they look at everything. So scars, for example.
Scars, okay.
Scars can tell them about previous surgeries you might have had.
Ah, interesting.
Or, maybe there's adhesions from those surgeries, things like that.
Yeah.
They're looking for discoloration.
Discoloration, like bruising.
Yeah, exactly. Is there any bruising that could indicate internal bleeding?
Oh.
They even look at, the shape of your abdomen.
The shape. Okay.
Yeah, is it distended, kind of swollen looking?
Right.
That could be a bunch of things. It could be gas buildup, could be fluid.
Interesting. I never would have thought that those visual cues would be so important.
Oh, yeah, they're really important. And then, of course, there's the palpation that we were talking about before.
Pressing, yeah.
So they're feeling for things like masses, guarding, and rigidity.
Wow. So they're really piecing it all together, huh? Using all their senses. But it's not just, what they can see and feel, right? What about other things that they're considering?
Oh, yeah. They're definitely looking for other signs. So, blood in your vomit, for instance, or blood in your stool.
Right.
These are all things that, you might not see right away, but can really point to something, bleeding internally.
Right. So essentially, this whole deep dive is showing us that, there's way more to abdominal pain than we probably think.
Absolutely. It's not just a simple stomach ache.
And paramedics are trained to consider a huge range of possibilities. And their assessment process, from what you're saying, is incredibly thorough.
It's amazing what they can pick up on.
Totally.
Yeah.
And this is all just, for us to understand how things work. Obviously, this isn't, for self-diagnosis or anything like that.
No, of course not. If you're experiencing abdominal pain, please go see a doctor.
Absolutely. Seek professional medical attention, always. It's amazing, though, how, just this little peek into a paramedic's world gives you a whole new perspective on something we often take for granted. It makes you realize that, even something as common as abdominal pain can have, a bunch of really complex, potentially even serious underlying causes. So, always be curious, keep learning, and don't ever hesitate to get, professional medical advice when you need it.
Couldn't agree more.
Awesome. Well, thanks for joining us for this deep dive.
My pleasure.
Until next time.
See you then.
All right, everybody, welcome back for another deep dive.
Yeah.
Today, we're taking on a topic that I am certain
Mm-hmm.
pretty much all of us have had to deal with at some point.
Absolutely.
Back pain.
Oh, yeah.
But we're not talking about like, oh, I went to the gym
Yeah.
and I just like really worked out and now my back's a little sore.
Right.
This is, we're going way deeper.
A little more intense.
We're looking at it from the perspective of
Right.
paramedics
Interesting.
and what they're looking for when they
Right.
go out on a call and somebody's complaining of back pain.
Yeah, that makes sense.
We've got some excerpts here
Okay.
from the guidelines that they use.
All right.
And
yeah.
it's really fascinating because it's like this whole other level of medical detective work.
Yeah. Paramedics have to think so fast on their feet and
Yeah.
consider so many different things. It's amazing.
So one of the things that really jumped out at me,
Yeah.
and I'm just going to say it,
Yeah.
it kind of like
What is it?
freaked me out a little bit,
Okay.
is that
yeah.
the very first thing that they're told to consider
Right.
is the possibility
Okay.
of some
Hmm.
life-threatening conditions,
Oh, yeah. So
like an aortic aneurysm.
yeah, they have to rule out the worst case scenario right away.
Like that is
Yeah.
intense.
You don't want to miss that.
No.
Absolutely not.
So
Yeah.
for those of us who maybe
Mhm.
don't know like
Yeah.
what that is,
Explain it.
tell us.
Yeah, so an aneurysm is basically a weakened spot in a blood vessel.
Okay.
And in this case, we're talking about the aorta, which
Yeah.
is the big one.
The big one.
That comes right out of your heart.
Right.
So if that bursts,
Well,
yeah, that's a major problem. That's
Yeah.
a massive internal bleeding situation, and it's often fatal. So yeah, paramedics, they gotta
rule that out.
rule that out first and foremost.
So
Okay.
an aortic aneurysm, that makes sense, like in a way.
Right.
Like I can see how back pain
You kind of see the connection.
could be a symptom of that.
Yeah.
But some of the other things that they list here,
Yeah.
I'm curious to get your take on.
Okay, shoot. Yeah.
Acute spinal nerve root,
Okay.
nerve root compression.
So that's interesting
Yeah.
because we're talking about
Yeah.
potential nerve damage there.
Okay.
And that's what makes back pain so tricky.
Yeah.
Because you could have something impinging on a nerve in your spine,
Yeah.
and depending on where that is,
Right.
you could be looking at tingling,
Okay.
numbness, weakness,
Mm-hmm.
even paralysis in some cases.
Oh, wow.
So yeah,
That makes-
paramedics need to figure that out quickly
Yeah.
to make sure the patient gets the right care.
Right. Because that's
Oh, yeah.
time sensitive.
Absolutely.
Okay.
Mhm.
So then we've got
What else we got?
pancreatitis
Yeah.
and peptic ulcers.
Now, those sound like they're more
Yeah. Those sound like stomach problems.
like
to me.
stomach problems.
Yeah. Not back problems.
Right.
So how is that?
So that's where the whole idea of
Yeah.
referred pain comes in.
deferred pain.
Yeah.
Okay.
It's fascinating, really,
Yeah.
because it means our body's wiring isn't always straightforward.
Okay.
Like, you think, oh, pain in my back
Right.
must be something wrong with my back.
Right.
But sometimes the pain signals get crossed.
Okay.
So you could have something going wrong in your abdomen,
Mm-hmm.
but you feel it in your back.
Oh, wow.
Yeah, and a peptic ulcer.
Yeah.
That's a classic example that
Mm-hmm.
can cause pain that radiates to your back.
Wow.
Yeah, it's wild.
So tricky.
It really is.
Okay.
Yeah.
So we've got the aortic aneurysm.
I got that one.
We've got the
Spinal nerve compression.
nerve root compression.
Yep.
And then
Pancreatitis.
pancreatitis and peptic ulcers.
Right.
And then just when I thought, okay, I think we've
What else could there be?
got all the bases covered,
Right.
they mentioned occult injuries,
Yes.
specifically pathologic fractures.
Interesting.
So these aren't like,
You know, your typical.
I fell off my bike and
Yeah.
broke my arm.
Exactly. This is different.
Yeah.
So with a pathologic fracture,
Mm-hmm.
the problem is that the bone itself is already weak.
Oh,
Yeah.
okay.
So this could be due to things like osteoporosis
Mm-hmm.
or even cancer
Oh, wow.
in some cases.
Okay.
And because the bone is weak, it might take very little force to break it.
Oh, gosh.
Or it could even happen spontaneously.
What?
Yeah, your bone just breaks.
Spontaneously breaks.
Yeah, pretty much.
Oh, my God.
And guess what one of the first signs might be?
Back pain.
Back pain.
Wow.
Yeah, it's crazy, right?
Okay.
It's wild.
So they've got this whole list
Yeah.
of things that they
They got to think
have
of.
to consider,
Yeah.
and then they get
Then
into
the real work begins.
what they call a minimum secondary survey,
Right, the hands-on part.
which seems pretty thorough to me.
Well, yeah, they have to be thorough.
Okay.
They're looking at the back, of course.
Right.
But also the chest, the abdomen, checking pulses, evaluating the extremities.
It's like a whole body scan.
You could say that,
Yeah.
but it all makes sense when you think about it.
Yeah.
Each step is like a clue.
Okay.
So let's break it down a little. First, you've got the back exam.
Right.
Now, you'd think that's just about finding the tender spot, right?
Right.
But it's more than that.
Oh.
They're looking for any deformities, signs of infection,
Yeah.
anything that just doesn't look or feel right.
Okay.
And then the chest and abdomen assessments,
Right.
well, that's all about trying to rule out those internal suspects.
Right, like the peptic ulcer.
Exactly.
Yeah.
Or pancreatitis.
Right.
And then you've got those pulse and extremity checks.
Yeah.
Super important.
Okay.
We're looking at blood flow, of course, but also nerve function. So can the patient feel things?
Right.
Can they move their limbs properly?
Okay.
Any changes there
Mm-hmm.
could mean something serious is going on.
Gotcha.
Yeah, it's all connected.
So it's interesting because they specifically mention checking bilateral blood pressure
Oh, yeah.
if they suspect a
If they think it could be an aneurysm.
thoracic aneurysm.
Right.
So
Mhm.
why is that important?
Why both sides?
Yeah, why both sides?
Well, because a difference in blood pressure between the arms
Okay.
can actually be a really strong indicator of a thoracic aneurysm.
Oh, wow.
Yeah, seems like a small detail.
Right.
But it could be the thing that saves a life.
Wow. So much to think about.
I know, right?
So I think we can all agree that
Yeah.
back pain
Mm.
is way more complicated
Oh,
than
yeah.
it more than meets the eye.
Seems on the surface.
That's
It's
awesome.
not just about the back itself. It's
Yeah.
about understanding
Whole
all these interconnected systems
whole body.
in the body. Yeah.
So I think a good question to ask ourselves is,
What's that?
why should we care?
Yeah, good question.
Like if we're not paramedics,
Right, exactly. Why do we need to know all this stuff?
why does it matter?
Well, think about it this way.
Okay.
The more you understand about the potential causes of back pain,
Mm-hmm.
the better you'll be able to communicate with your doctor
Okay.
if you're experiencing it.
Right.
You'll be able to advocate for the right tests
Yeah.
and make more informed decisions about your own health.
So knowledge is power.
Absolutely.
Yeah.
Knowledge is power when it comes to your health.
I like that.
Yeah.
So if this deep dive is kind of like,
Sparked your curiosity.
yeah, it piques your interest
Yeah.
about some of the things we talked about, like referred pain
That's the big
or
thing.
aneurysms or any of these other
Yeah.
conditions,
Yeah.
don't stop here.
Yeah. Keep learning.
Yeah.
The human body is amazing. It's
Yeah.
so complex.
Yeah.
And the more you learn about it,
Yeah.
the better you can take care of yourself
That's a great point.
and those around you.
Yeah. All right, everybody.
All right.
Thanks for joining us for another deep dive.
Until next time.
We'll catch you next time.
Bye.
All right, everybody. Welcome back for another deep dive.
Yeah.
Today we're
Mm-hmm.
we're going into the world of paramedics.
All right.
But we're not doing anything too crazy.
Okay.
It's something that I think everyone has experienced at one point or another,
Oh, yeah.
and that is a nosebleed.
Yeah.
And we have an excerpt here from an actual paramedic standard.
Wow.
And you would
Yeah.
think this would be pretty straightforward.
Yeah, just plug it up and you're good to go.
Yeah, exactly.
That's what I would think.
But there's a lot more to it.
Interesting.
So the scenario is you're a paramedic,
Okay.
sirens are blaring, you show up on the scene,
Mm-hmm.
and someone has a nosebleed.
Yeah.
So what's the first thing that goes through your mind?
Well, the first thing is honestly is safety. You have to assess the scene and you have to determine if there are any threats to the patient's life, their limbs or their ability to function.
Oh, okay, that makes sense.
Yeah.
But I see in the standard here that they specifically call out airway obstruction.
Right.
As a major concern with nosebleeds,
Yeah.
isn't that a little bit overkill?
Not at all. Because sometimes the nosebleed can get pretty bad and it can affect their breathing. Think about it. When you're bleeding like that, blood clots can form.
Oh.
And in the nasal passages, that can make it difficult to breathe. Or in a really bad situation,
Yeah.
you could aspirate blood into the lungs. So
Oh.
it's important.
I never even thought about that.
Yeah.
So once you've ruled out any immediate threats,
Mm.
what happens next?
Okay.
I see here something called a secondary survey.
Yes.
What is that?
So that's like the detective work.
Oh, okay.
Once the immediate danger is over, we can kind of dig in a little bit deeper and gather more information to get the full picture of what's happening. We estimate the blood loss,
Okay.
but we're not just looking at it. We're considering how long the bleeding has been going on,
Yeah.
the flow rate, if
Mhm.
there are any clots, even how much blood-soaked material is around the scene.
Okay. Why all the fuss about blood loss?
It's just a nosebleed, right?
You'd be surprised. It can. Estimating blood loss can tell us how serious the situation is, and then it can inform us about whether the patient needs additional interventions, like IV fluids
Oh,
or a blood transfusion potentially.
okay. That makes a lot of sense. What else is part of this secondary survey? I see here that the standard mentions checking for foreign bodies
Right.
and asking about headaches.
Yeah.
Why are those details important?
Well, it's kind of like, it's like putting together a puzzle. Sometimes there's a foreign body in the nose,
Yeah,
like a bead or a small toy,
especially with kids.
especially with children.
Yeah,
That could be the cause of the nosebleed.
yeah.
And then also a really bad headache might be a sign of something more serious that's going on that needs further investigation. So it's really all about connecting all those dots to make sure that we're providing the best care possible. So it's not just about stopping the nosebleed. It's also about figuring out what caused it and if there are any other issues that need to be addressed. That's fascinating. The standard also talks about being proactive and anticipating potential problems.
Uh-huh.
What kinds of problems are we talking about here?
Well, we already talked about airway compromise, but we're also looking for things like hypotension.
Hypotension.
Yeah, which is just a fancy word for low blood pressure.
Okay, hypotension.
But how can a nosebleed cause low blood pressure?
It all comes down to the volume of blood. If someone has been bleeding a lot for a long time, they could lose enough blood that their blood pressure drops.
Oh.
And that can be a real problem. That would require immediate intervention.
So you're basically thinking one step ahead,
Yeah.
anticipating potential complications before they even happen.
Exactly. It's all about being prepared and staying alert. Even something seemingly simple like a nosebleed could take a turn for the worse. And we need to be ready for anything. Yeah, it's pretty incredible how much thought and detail goes into handling even the most common medical situations. It really shows the level of expertise and care that paramedics provide.
Yeah.
So to wrap things up, we've learned that paramedics have a systematic and thorough approach to dealing with nosebleeds. They're focused on safety gathering, detailed information, and anticipating potential complications.
It's like a well-choreographed dance where every step has a purpose.
Exactly. And it's not just about following the rules, it's about critical thinking, problem solving,
Yeah.
and adapting to each individual situation.
Right.
Now, here's something to think about. We've talked about the standard approach, but in the real world, each case is unique. What other factors beyond what we talked about today could make a nosebleed more serious than it looks at first? Think about underlying medical conditions, medications, their patient's age, and their overall health. It's a complex puzzle, but understanding all the pieces can really help us give the best care possible.
That's it for this deep dive.
Yeah, thanks for listening.
We'll see you next time.
See ya.
Bye.
Bye. All right, so have you ever had one of those headaches that kind of makes you stop and think? Like,
Yeah.
maybe this is a little more than just needing like another cup of coffee or something.
Right.
So today we're going to do a deep dive on headaches,
Okay.
but not just any headaches.
Yeah.
The kind of headaches that make paramedics worry.
Oh.
And we're going to go behind the scenes to see how they figure out if a headache is actually something serious.
Okay.
And it's all based on real standard procedures that paramedics use in the field.
Interesting.
So kind of a crash course in headache triage,
I like it.
right?
Yeah.
So paramedics, they're trained to think fast,
Right.
right? When they show up at a scene, they've got to decide, is this headache a big deal or is it just...
Yeah, they don't have a lot of time to make that decision.
No,
They don't.
really.
The important
Well, no.
one.
Yeah.
Yeah.
And sometimes it's not obvious at all.
Right.
I mean, some people might think, oh, a paramedic.
They just show up if there's like a car accident
Yeah.
or something really dramatic.
Right.
But a headache,
Right.
it just seems so normal, right?
Yeah.
So how do you convince someone that a headache could actually be
Yeah. Yeah.
a real emergency?
It's a serious.
Yeah.
Yeah.
Well, I think the thing to remember is that
Yeah.
headaches, they're so incredibly common.
Uh-huh.
And so it's really easy for all of us to just kind of brush them off.
Yeah.
But for a paramedic,
Right.
it's like they're looking for clues. And
Yeah.
sometimes it's like a race against time.
Yeah.
Because if they see the wrong kind of headache,
Right.
they've got to move.
Yeah.
So paramedics, they're trained to look for these,
Okay.
what we call life-limb function threats.
Okay. So what kind of threats are we actually talking about here?
Well, there are 4 main categories that they're trained to consider.
Okay.
First, anything that's going on inside the skull itself.
So in the brain.
Yeah, intracranial events. So this could be something like a hemorrhage,
Okay.
which is basically bleeding in the brain,
Right.
or it could be a thrombosis,
Okay.
which is a blood clot that's blocking blood flow.
Oh, wow.
And even a brain tumor can sometimes fall under this category.
So that's some really serious stuff right off the bat.
Oh, yeah.
So what else is on that list?
Well, the next thing they think about are infections
Okay.
that can affect the brain and the nervous system.
Yeah.
So like meningitis,
Hmm.
which is
Yeah.
an inflammation of the membranes that surround the brain and the spinal cord.
Oh, I see.
And then there's severe hypertension,
Which is...
extremely high blood pressure.
Gotcha.
And that's a big one because, if you think about high blood pressure like a garden hose,
Okay.
Yeah. You're cranking up that pressure too high.
Mm.
Eventually, something's got to give.
All right.
And in this case, it could be a blood vessel in the brain.
Oh, wow.
And that can lead to a really dangerous situation.
Okay, so we've got the things happening inside the skull. We've got
Okay.
infections. We've got high blood pressure.
That's right.
What about that final category?
The last one is exposure to toxins.
Oh.
And carbon monoxide poisoning is kind of a classic example here. You can't see it.
Yeah.
You can't smell it.
Right.
But it can cause headaches,
Uh-huh.
dizziness,
Right.
and in high enough concentrations, it can even be fatal.
Yeah, that's really scary.
Yeah.
So we've talked about those big categories that paramedics are worried about, but what are some of those specific signs that they look for
Yeah.
that tell them, okay, we need to pay attention to this headache?
Right. So there are some real red flags.
Okay.
So imagine someone's never had a headache in their life,
Okay.
and then all of a sudden they get this
Wow.
really severe headache out of nowhere.
Okay.
That's a major red flag.
Gotcha.
Another one is a headache that someone's had recently, but it suddenly gets much worse.
So like any major change in the pattern
Exactly.
could be a cause for concern.
Yeah, anytime it's different or
Okay.
really sudden,
Yeah.
that's when we start to pay attention.
So let's say we've got this sudden severe headache or the pattern's changed.
Right.
What else are they looking at?
So if you have those things
Yeah.
going on, and then they also see some of these other symptoms, it's a really big warning sign.
Okay, I'm all ears.
So first, they look at the person's mental state.
Okay.
Are they acting confused, disoriented,
Right.
unusually irritable?
Hmm.
This is what we call an altered mental status.
Okay.
And it can be a big clue
Gotcha.
that something more serious is happening.
Okay.
Similarly, if someone's unusually drowsy
Right.
or difficult to wake up,
Ah.
that decreased level of consciousness is a major concern.
So just being really sleepy?
Yeah.
Along with the headache?
Yeah, especially if it's unusual for them.
Right. Okay, what else are they looking for?
Well, another thing they look for are what we call neurological deficits.
What does that mean?
So basically it means there's some kind of disruption in how the brain and the nerves are functioning.
Gotcha.
So you might see weakness,
Hmm.
numbness on one side of the body,
Okay.
difficulty speaking,
Uh-huh.
problems with coordination.
I see.
So anything that's
Of
a
course
little
too.
off with their neurology.
Yeah, okay.
Then they also look for what we call neutral rigidity.
Neutral rigidity.
Yeah.
I don't know what that is.
It's a stiff neck.
Oh, okay.
And if that stiff neck is accompanied by a fever,
Okay.
it could point to an infection,
Got
like
makes,
meningitis.
makes sense.
Yeah.
Now, I'm guessing our eyes can also
Oh, yeah,
reveal a lot.
absolutely.
Right.
Paramedics always check the pupils.
Uh-huh.
They should be equal in size,
Okay.
and they should react quickly to light.
Yeah.
If one pupil is bigger than the other,
Okay.
or they're slow to react,
No.
that's another huge red flag. And any visual disturbances like blurry vision, seeing spots,
Yeah.
double vision,
No.
all taken very seriously.
So it's really interesting, the pupils.
Yeah.
I never would have thought of that.
Yeah, they can tell us a lot.
Okay, so let's say the paramedic is starting to think that this headache
Right.
could be something more serious.
Uh-huh.
What happens next?
So at that point, they're going to move on to what we call a secondary survey,
Okay.
which is a more targeted assessment.
Right.
They'll check the head and neck,
Mm-hmm.
really focusing on those pupillary responses we talked about.
Yeah.
They'll check for abnormal motor function.
What does that look like?
So basically, they're looking for any signs that the muscles aren't working properly.
Okay.
So they might ask the person to grip their hands, see if they can move their arms and legs equally well,
Right.
or even see if their arm drifts downward when they close their eyes.
Okay.
It's all about looking for those subtle clues
Right.
that something might be off.
So they're kind of like detectives,
Yeah,
looking for those little things.
exactly. You're piecing together the whole puzzle.
So when I get a headache, I should be thinking about all this stuff.
Yeah, I mean, it's good to be aware of the red flags.
Right.
Because like we said,
Uh-huh.
it's always better to err on the side of caution
Yeah.
if you're ever in doubt.
Right.
Especially if you're experiencing those red flags we talked about,
Uh-huh.
seek medical attention.
Yeah. Great advice. That's really helpful. I think we all learned a lot today.
I hope so.
So this wraps up our deep dive into the world of non-traumatic headaches.
Yeah.
Hopefully now we can all be a little more informed
Yeah, knowledge is power.
about our health
That's right.
and recognize when a headache might be something more serious.
Exactly.
Thanks for listening.
Thanks for having me. All right. Welcome back, everybody, to the deep dive. We're diving into some pretty intense stuff today.
Yeah, definitely high stakes.
So we're looking at guidelines for paramedics
Mm-hmm.
when they're responding to a patient
All right.
who might be violent or aggressive and trying to figure out, like,
Yeah.
how do they balance providing care
Exactly.
with, you know, like
Keeping themselves safe.
keeping themselves safe? Exactly. Because
That's a tough one.
you're going into a situation that's potentially dangerous
Absolutely.
and you still got to do your job.
You have to figure out, is this a medical emergency? Or is this someone who's intending to do harm?
Right. And how do you tell the difference? Like the guidelines talk about considering
Organic disorders.
organic disorders.
So, you're showing up and maybe someone is presenting as aggressive, but
Right.
is there a medical reason for that?
Yeah, like is it a symptom,
Exactly.
not the problem
Is
itself?
this a head injury? Is this, someone with dangerously low blood sugar? So they might actually need medical attention urgently.
Exactly. The aggression is a symptom of something else going on.
Oh, wow. So then how do you, as a paramedic, figure that out?
Well, I mean, that's the real challenge, right?
Yeah.
I mean, it's one thing if you can talk to somebody calmly, but if you're showing up on scene and somebody is,
Right.
already agitated or possibly even a threat.
Yeah, how do you even begin to assess?
Well, I mean, they talk about really reading body language
Yeah.
and sort of being on high alert, looking for those signs.
Like what kind of signs?
Well, are they making direct eye contact with you?
Hmm.
Or are their eyes kind of darting around? Are they clenching and unclenching their fists? Are they breathing really shallow and rapid?
So these are all kind of cues.
And they're all signs that it might be escalating, potentially.
Oh, okay. Okay. So you're starting to pick up on these cues and you're like, okay, this feels dangerous. What do you do?
Well, the guidelines are pretty clear. Your personal safety comes first.
So request police assistance, especially like if there's an active shooter or if there's evidence that there's violence going on.
Okay, so in those situations, you would wait
You wait,
for the police to arrive.
especially in those high risk situations.
Right, but doesn't that, potentially delay giving medical care?
It does, and that's, it's that balance. But
Yeah.
I think, they're emphasizing that if a paramedic gets hurt,
Right.
they can't help anybody. So securing the scene is the
Right.
priority, and once it's safe,
Right.
then they can move in and treat people.
Yeah, that makes sense. It's such a tough call to make, though, right?
Ew.
Because you want to help,
You do.
but you also have to
Protect yourself.
protect yourself. So I guess that's where, like, gathering information from other people
Yes.
becomes really important.
Really important.
If you are in a situation where you're waiting
Yeah.
for the police to arrive, you can talk to bystanders. If the patient's not being cooperative, maybe somebody else can give you some clues.
Yeah. Have they been drinking? Have they suffered a recent injury? Do they have a history of violence?
Right, right.
All of that will help inform.
Wow, so it's like building a whole profile
Yeah.
while you're also trying to just stay safe.
Absolutely.
Okay, so let's say, it's not a situation where the police are called, but the patient's still agitated. What are some of the de-escalation tactics that a paramedic can use?
Well, first and foremost, the guidelines say if you can safely withdraw,
Oh.
do it. Create some space, reduce the tension. But if that's not possible, if you're in a situation where you can't withdraw,
Right.
then it's really about trying to calm the person down verbally.
Okay, so like talking calmly yourself.
Yeah, using non-threatening body language,
Okay.
validating their feelings
So it's almost like you're meeting that aggression
with calm
Yeah.
and with understanding.
It seems counterintuitive, right? Like someone's being aggressive towards you, and you're going to be like, yeah, I understand why you're upset.
But think about it. If you're in immense pain or if you're experiencing some kind of mental health crisis,
Right.
you might lash out because you feel like nobody's listening.
Yeah.
Nobody gets it.
So you're acknowledging their feelings?
Exactly. And that can often, help de-escalate.
It's like you're saying, I see you, I hear you.
Right. And it might be as simple as saying, I can see you're really upset right now.
Wow. Okay, so, de-escalation tactics are great,
Mm-hmm.
but sometimes they don't work.
And that's
And that's when things can get even trickier, right? Because the guidelines talk about restraints.
Restraints.
Can you talk a little bit about, like, when a paramedic might have to make that decision?
Yeah, and I think that's always a last resort.
Right.
It's not something that you want to do unless it's absolutely necessary.
And why would it be necessary?
Well, to prevent harm. To
Well.
prevent harm to the patient themselves
Right.
or to others. And, the mental health standard, there are guidelines about how to use restraints ethically
Right.
and safely.
I imagine that's a really
It's very difficult.
difficult call.
It is, because you're dealing with someone who's already agitated.
Right.
And you're adding to that.
You're adding to that by restraining them.
But sometimes it's the only way to keep everyone safe.
Wow. It's really complex.
This is really complex.
So, we were talking about complex situations.
Mhm.
The guidelines also mention patients who might have embedded ECD probes.
Ah.
Can you explain what those are and why that's a special consideration?
Sure. So an ECD is an electronic control device,
Mhm.
which most people know as a taser.
Right.
And so it shoots out these probes that deliver an electric shock.
Okay.
And sometimes those probes can stay in the patient's skin.
Okay.
And so the general rule is you remove them.
Okay.
But there are guidelines.
That's what I was going to ask about. The guidelines say, like, consider leaving them in.
Right. Because think about it. If the probe is lodged somewhere dangerous, like near the neck, or if it's tangled up with something,
yeah.
it might be more risky to take it out.
Right.
And then there's also the issue of evidence. Sometimes the police need to document where the probes are. And so paramedics might have to coordinate with them on that.
So it's like you're doing a surgery,
Kind of, yeah.
but you're also thinking about the legal ramifications.
Exactly. There's a lot going
Oh
on.
my gosh. Well, we've covered a lot today.
We have.
We talked about assessing potential threats,
Mm-hmm.
recognizing those subtle signs,
Yeah,
the importance of personal safety,
absolutely.
and knowing when to call for police assistance,
Mm-hmm.
de-escalation techniques,
Right.
the complexities of restraints,
Yes.
and then, these unique situations like with the ECD probes.
What's fascinating to me is just seeing how, it's not just medical knowledge
Yeah.
that these paramedics need.
They meet everything.
They need awareness of the situation, quick thinking. They have to make decisions under pressure
Wow.
and constantly balance caring for the patient with their own safety.
Yeah, it's really incredible what they do.
It is.
And I think, it's easy to take for granted, but when you really deep dive into
Yeah.
these guidelines, you see how much is involved.
Absolutely.
So to all the paramedics out there, thank you
Great, thank you.
for everything you do and for everyone listening.
Yeah. Next time you see a paramedic, just remember, they're not just medical professionals. They're
Mhm.
highly trained first responders.
They are.
Dealing with stuff that most of us never will.
Absolutely.
So really, a lot of respect to them.
Absolutely. Well, this has been a fascinating deep dive.
It has.
We'll see you next time.
See them.
Ever get that kind of icky, nauseous feeling and just kind of shrug it off?
Yeah.
Well, turns out paramedics, they don't shrug it off.
Nope.
They see nausea and vomiting as like a giant red flag.
Yeah.
And that's what we're diving deep into today.
That's right.
So we're using these paramedic guidelines. We're going to figure out why nausea and vomiting can be way more than just, some bad takeout,
Absolutely.
and how you can stay safe.
We often just think, oh, upset stomach, something I ate. But paramedics are trained to think much more broadly.
Right.
See nausea and vomiting as potential signs of,
All sorts of things.
wide range of conditions. And some of those are really, really serious.
And the guidelines actually list out a bunch of like life-threatening possibilities. Some
Yeah.
of them kind of make sense, like you said, right?
Mm.
Anaphylaxis or like,
Yeah.
really bad infections.
Yeah.
But a heart attack,
Yeah.
really?
It's true.
I mean, why would something like a STEMI
STEMI.
cause nausea and vomiting?
Well, think of it this way. The stress of a heart attack,
Yeah.
it just throws your whole body into that fight or flight mode.
Right.
And all that adrenaline surging through you can really mess with your digestive system.
Uh-huh.
That's where the nausea comes in.
Interesting.
It's not always there in every heart attack case.
Right.
But if it is, and especially if it comes along with, that classic chest pain, the pressure,
Yeah.
that's a huge red flag for paramedics.
Wow, I had no idea.
Yeah.
There was like that connection.
Yeah, it's really
So
interesting.
it's not just about the heart itself. It's
No.
like the body's whole reaction
It's the body's way of saying something is very wrong.
to what's happening.
Exactly. And it just goes to show how interconnected everything is.
Yeah.
Our systems don't work in isolation.
Right.
And that same fight or flight response, that's at play with anaphylaxis too.
Oh, okay.
Severe allergic reaction. And in that case, the body just dumps all these chemicals into your system. Blood pressure drops, breathing gets hard, and yep, you guessed it.
Nausea and vomiting.
Nausea and vomiting.
So in both those situations, it's like the body's alarm system is just going crazy.
Totally. It's like a full-blown system overload.
But what about something like
Yeah.
increased intracranial pressure?
Yeah.
That sounds pretty intense.
It is.
And I don't immediately see a connection to like nausea and vomiting.
Well, it all comes down to location.
Okay.
In the brain, that is. Increased pressure inside the skull, which can come from head injuries, tumors, or any number of neurological things,
Sure.
can actually affect the vomiting center in the brain.
Oh, wow.
And when that happens, well,
Nausea and vomiting.
you got it. So it's like another case of seemingly unrelated systems
Yeah.
being totally intertwined.
Probably.
It's fascinating, but it's also why these symptoms can be so tricky.
Yeah. So, I mean, we're talking about paramedics, but how can like a regular person at home know
Right.
when their nausea is like serious enough
Yeah.
to warrant a trip to the ER?
That's the million-dollar question.
Right.
And honestly, it comes down to trusting your instincts.
Okay.
If the nausea is really intense, doesn't let up, or if it's got these other like scary friends tagging along.
Like what?
Chest pain,
Okay.
difficulty breathing,
Mhm.
confusion,
Yeah.
severe abdominal pain.
Got it.
Always better to play it safe.
Yeah.
Get to the ER. Let him figure it out.
Right. Because it seems like nausea and vomiting,
Mm-hmm.
they're kind of like a smoke alarm.
That's a great analogy.
They tell you something's wrong,
Yep,
but you got to investigate
exactly.
to figure out where the fire is,
You need to find the source.
so to speak.
And that's where those paramedic guidelines really highlight the importance of a good patient assessment,
Right.
especially that secondary survey,
Secondary survey.
focused on the abdomen.
Okay. Break that down for us.
Sure.
What is a secondary survey?
Okay, so a secondary survey, it's basically a head-to-toe exam.
Okay.
Very systematic.
Got it.
In this case, the paramedic is going to really carefully feel the abdomen,
Mm-hmm.
looking for anything out of the ordinary.
Like what?
Lumps, tenderness, that kind of rigidity.
Okay.
They'll also listen to the bowel sounds, see if they're off,
Interesting.
check for any distension,
Mm-hmm.
and all that gives them clues about what might be going on inside.
Right. Because obviously they can't see in there.
Right. They have to rely on these other cues.
So the guidelines also lump together things like toxicological emergencies,
Mm-hmm.
bowel obstructions,
Mhm.
acute pancreatitis,
Yep.
and intra-abdominal emergencies.
Right.
What's the common thread there
Good question.
that would trigger nausea and vomiting?
It all boils down to serious disruptions
Okay.
in the body.
Okay.
So, for example, a bowel obstruction.
Right.
It's basically a traffic jam in your intestines.
Ah,
Things can't move through like they should.
makes sense.
So you get this backup, and that can trigger the nausea and vomiting.
Got it.
Toxicological emergencies, that's a whole other beast.
Right.
Could be from ingesting something poisonous or maybe a drug overdose.
Mhm.
Either way, it throws the body's systems out of whack.
Yeah.
And often you see nausea and vomiting.
Sure.
And then things like acute pancreatitis, that's inflammation of the pancreas. That causes intense pain.
Yeah.
And guess what?
Nausea and vomiting.
Nausea and vomiting.
It's amazing how the body can like
I know, right?
react in similar ways
Yeah.
to so many different problems.
The human body is a complex and mysterious thing.
It is.
It is.
The guidelines also mention something called uremia,
Uh,
which I got to admit, I had no idea.
yeah, it's not a term you hear every day.
What is that?
Uremia is basically a buildup of waste products in your blood.
Oh,
It
duh.
usually happens because of kidney failure.
Oh, wow.
It's pretty serious. It
Yeah.
can cause all sorts of problems,
It-
including, you guessed it, nausea and vomiting.
Of course. And speaking of serious situations, the guidelines mention airway compromise.
Right.
That definitely sounds scary.
Yeah, it's a big concern.
What makes vomiting so risky in that regard?
Well, when someone vomits, there's this risk of aspiration,
Aspiration.
meaning some of that vomit can get into the lungs.
Oh, gosh.
Not good.
No.
Could cause some serious breathing problems, including something called aspiration pneumonia. So paramedics, they're trained to be super careful about this.
So, like, how do they prevent that?
Well, they'll position the patient on their side.
Okay.
Sometimes they have to suction out the vomit,
Wow.
and they're constantly monitoring the airway.
Makes sense. So after all this, it's pretty clear that nausea and vomiting are way more complicated than we might think.
Absolutely.
And while they're often due to something minor, like we said,
Sure.
they can also be like these warning signs. It's
Yeah.
like those flashing red lights.
Wait.
Pay attention.
Yeah.
This whole deep dive, it's been about looking beyond the surface,
Right.
understanding how serious these common symptoms could actually be.
Mm-hmm.
So the next time you feel that nausea coming on, don't just automatically reach for the Pepto-Bismol.
Yeah.
Listen to your body.
Yeah.
Think about what else is going on.
Right.
And remember, paramedics, they're trained to look beyond the obvious.
Right.
You should too.
Great advice.
Stay safe out there.
We'll see you next time.
See ya. Ever wonder what happens when a baby needs urgent care right after birth?
Yeah, like those scenes in movies where it's all frantic and everyone's yelling.
Exactly. Today, we're diving deep into how paramedics handle those crucial first moments when they encounter a newborn in need of immediate attention.
Cool. So like a behind-the-scenes look at emergency neonatal care.
Exactly. We're going to break down a section of the obstetrical standards for paramedics, specifically the neonate standard. It's like a playbook for paramedics outlining how to ensure a newborn's health right after birth, especially when things get a bit complicated.
Sounds intense. Like what kind of complications are we talking about?
Well, think about it. You're a paramedic, you arrive at a scene, and bam, you're thrust into a situation where a new life has just entered the world. And maybe the delivery wasn't straightforward, maybe the baby isn't breathing properly.
Okay, yeah, now I see what you mean. That's a lot of pressure. So where do they even begin?
Well, the first thing that's super important is that paramedics are trained to focus on both the mother and the baby.
Makes sense. You can't have one without the other, right?
Exactly. Their well-being is totally intertwined. Like, if the mother's having complications, it could definitely impact the baby's health, too.
Right, right. So it's like a 2-for-1 kind of situation.
Yeah, and time's of the essence, obviously. Paramedics have to act fast to assess the situation and figure out what needs to be done.
I bet they have like a special set of skills for dealing with newborns.
Oh, absolutely. They use what's called a primary survey, which is basically a rapid assessment to spot any life-threatening issues. And this is where their specialized training in neonatal care really kicks in.
Because babies aren't just like miniature adults, right?
Exactly. Their bodies work differently, their anatomy is different, so paramedics need a specific approach.
So during those first few seconds, what are the big things they're looking for?
3 main things. They're checking if the baby was born full term, if they have good muscle tone, and if they're breathing without any struggles. If any of these are missing, it's a signal that the baby might need immediate intervention.
Intervention meaning?
Well, it could range from something as simple as suctioning the baby's airway to something as complex as neonatal resuscitation.
Whoa, neonatal resuscitation. That sounds serious.
It is. It basically involves advanced life support procedures to get the newborn breathing and stabilize their vital signs.
Yeah.
Imagine how delicate those procedures must be.
Wow. It's pretty amazing that paramedics are trained to handle such a delicate situation.
Right. It's a testament to their skill and how much training they go through. But even with all that training, gathering information is crucial. You know, it's not just about jumping into action. It's about understanding the bigger picture.
Makes sense. So like what kind of information are we talking about?
Well, they try to get as much information as possible about the pregnancy, the labor, the delivery itself. Was it a full-term pregnancy? Were there any complications? Was the labor super difficult or really fast?
Really fast. Like how fast?
What they call precipitous delivery, where the baby basically just like shoots out.
Oh, wow. I didn't know there was a term for that. So even something like that matters.
Absolutely.
Yeah.
A precipitous delivery could mean there's potential trauma to the baby just because of how quickly everything happened. So yeah, details matter big time.
Got it. So once they've got all the intel, what happens next? What do they actually do?
All right, so regardless of whether they helped deliver the baby or arrived after the fact, paramedics jump into action with a series of steps. First, they reassess the mother. Got to make sure she's doing okay, right?
Right, of course.
Then they turn their attention to the baby. They'll wipe the baby's nose and mouth, make sure there's nothing obstructing the airway. Then they clamp and cut the umbilical cord. And this is important. They got to position the baby in a way that keeps their airway clear.
Positioning a tiny baby. That sounds tricky.
It is. They might use a little rolled up towel to support the baby's head, being super careful not to bend their neck back too far. It's a delicate balance to get that airway open.
Wow, I can only imagine. Talk about attention to detail.
Oh, and there's more. They also record the time of delivery and tag the baby with that information and the mother's name. It might seem small, but it's crucial for making sure the baby's care stays consistent.
Ah, the good old paper trail. Always important. So what about keeping the baby warm? Aren't newborns, like, really bad at regulating their own temperature?
Yeah, totally. That's another big part of neonatal care. Paramedics are pros at using blankets and stuff to help the baby maintain a normal temperature. And whenever they can, they encourage skin-to-skin contact between the mother and baby.
Aw, that's sweet. I mean, obviously it helps with warmth, but isn't there, like, a bonding thing, too?
Exactly. Skin-to-skin contact is amazing for temperature regulation and helps the mother and baby bond right away. And if the mother's able to, it even allows for breastfeeding, which is a win-win for both of them.
So it's like even in those first few minutes, they're already thinking about the long-term health and well-being of the baby.
Absolutely. So let's talk about how paramedics decide if a baby needs to be transported to the hospital right away.
Okay, so what's the deciding factor?
They use something called the APGAR score. Basically, it's a quick assessment they do at 1 and 5 minutes after the baby's born.
An APGAR score. I think I've heard of that.
Yeah, it looks at 5 things. The baby's appearance, like their skin color, pulse, their reflexes, how active they are, and of course their breathing. It gives paramedics a snapshot of the baby's overall condition in those crucial first minutes.
So it's like a quick checklist to make sure everything's working as it should be.
Pretty much.
Yeah.
And a low score, especially at that 5-minute mark, is a big red flag. If the score is below 7, it usually means the baby needs to be transported to the hospital ASAP, maybe even for more intensive care.
Wow, so that score can really make a difference. It's incredible how much responsibility paramedics have in those situations.
Totally. They have to make life-altering decisions under immense pressure.
Yeah.
And, it really makes you appreciate the incredible training and dedication of these first responders. I mean, they're truly on the front lines, making sure every baby gets the best possible start in life.
Yeah, absolutely. It's pretty awe-inspiring when you think about it.
Totally agree. So we've covered a lot today, from the rapid assessments to those crucial first actions, the APGAR score. It's a whole lot to take in.
It is. It's amazing how much happens in those first few minutes after a baby's born.
Right. It's a whirlwind of activity, but it's all designed to ensure the baby's safety and well-being. And, it makes you think about the emotional side of things too, right? Can you imagine the roller coaster of emotions the parents must be going through in those moments?
Oh, absolutely. It must be a mix of relief, worry, pure joy, all at the same time.
And the paramedics have to navigate all of that while providing critical care. It's pretty remarkable. And you know what? If today's deep dive has sparked your interest in neonatal care, there's a ton of information out there. Check out some resources online or at your local library. It's a fascinating field. And hey, knowledge is power, right?
For sure. And who knows, maybe one of our listeners will be inspired to become a paramedic themselves.
That would be amazing. Anyway, that's all the time we have for today's deep dive. Thanks for joining us.
See you next time. Welcome to another deep dive, everybody. Today we're going to be looking at the world of paramedics in Ontario.
Ooh.
But we're going beyond, the sirens and the flashing lights, all that
Right.
exciting stuff.
Yeah.
And we're going to be diving into the standards that guide, every action they take.
Okay.
We're going to be looking at a document called the Basic Life Support Patient Care Standards.
Mhm.
So this is kind of like the rule book, I guess you could say, for paramedics in Ontario.
Yeah.
And joining me today is an expert who can kind of shed some light on this.
Absolutely. Yeah. I'm happy to be here.
Glad to have you. So right off the bat, something that struck me as interesting is that these standards don't just apply when a paramedic is on the job officially.
Right.
It's like a constant commitment to patient care.
Yeah, it's interesting you say that because it actually extends beyond the ambulance.
Really?
Yeah.
So are you saying that a paramedic is technically on even when they're off duty?
Yeah.
So let's say they're at the grocery store and they see somebody, trip and fall.
Right.
Are they bound by these standards?
Yeah, the document very clearly says that these standards apply regardless of if a paramedic is on or off duty.
Wow.
So, yeah, they're bound by the same ethical and professional considerations, always.
So it's like they're never really off?
Pretty much, yeah.
So imagine you're a paramedic and you're having a nice, quiet dinner, just relaxing, off duty.
Mm-hmm.
And all of a sudden, somebody collapses in the restaurant next to you.
Yeah.
You're not just like a bystander anymore.
Nope.
You're equipped to act even though you're technically off the clock.
Yeah, you're expected to.
That's a lot of responsibility.
Yeah, it's a lot of responsibility.
But that makes me wonder, what kind of actions are we talking about? What do these standards, dictate?
So the standards actually take an assessment-based approach.
Okay.
So you can kind of think of it like a detective's investigation. So instead of having, a specific instruction for every single condition a paramedic might encounter,
Right.
the standards focus on assessing those presenting symptoms.
Okay.
So, for example, if somebody is having shortness of breath,
Mm-hmm.
the paramedic will follow a very set procedure to gather clues to kind of solve that mystery of what's wrong.
So it's less about jumping to conclusions and more about systematically figuring out what's going on,
Exactly.
like a medical Sherlock Holmes.
That's a good way to put it.
But are these standards just like suggestions, or are they like hard and fast rules that paramedics have to follow?
That's where the language gets interesting,
Okay.
because the document uses very specific phrasing,
Okay.
often stating the paramedic shall, and then it's followed by a list of actions.
Mm-hmm.
So this emphasizes that these are mandatory guidelines.
Okay, so it's all about following the rules. No room for interpretation.
Well, not always.
So what about those situations where maybe things are a little bit more chaotic? Like real life isn't always black and white.
Yeah.
Are there ever times when a paramedic might need to like deviate from the script?
There is what you might call an escape clause.
Okay.
So the document does acknowledge that there might be extenuating circumstances
Mm-hmm.
where sticking strictly to the standards might be impossible or even dangerous.
So like they have to make a judgment call.
Yeah.
And maybe deviate from the strict protocols.
Sometimes.
That seems like a big deal.
Yeah, it's not about just throwing the rule book out the window,
Right.
but it's about recognizing that real life is messy.
Sure.
So let's say you arrive at an accident scene and it's chaotic. There are multiple victims and you have very limited resources.
Mm-hmm.
So the textbook approach isn't always going to work in that situation.
Yeah.
So these extenuating circumstances allow a paramedic to prioritize, to adapt, and to use their training to make those tough calls on the fly.
So what kind of situations would we be talking about that would qualify for these like extenuating circumstances?
So you could picture like a multi-casualty incident where resources are stretched really thin.
Okay.
Or maybe a patient is trapped in a location that's dangerous.
Right.
Maybe some critical equipment malfunctions, or there's a language barrier.
Wow. So many things.
Yeah.
So it's like factors outside of their control that might force them to make changes.
Right.
That's a lot of responsibility.
It is.
So how do they ensure that like paramedics are making the right calls in these really high pressure situations?
There is a system of checks and balances in place.
Okay.
So the document mentions these quality assurance programs
Mm-hmm.
that monitor the care provided and ensure accountability.
Okay.
And they also identify areas for improvement.
So it's like constant learning and feedback.
Right.
And I imagine paramedics are expected to document all of this.
Absolutely. Yeah.
Yeah.
They need to document the circumstances and the rationale behind their actions.
So it's really this dance between rigorous standards and then that flexibility to handle these real life situations. But it can't just be reacting to emergencies, right?
Right.
There's got to be systems in place to like improve and evolve as a field.
Yeah, for sure.
What does that look like?
So the document kind of hints at these innovations in paramedicine,
Okay.
talking about things like specialized treatment or transport options.
Now that gets me really curious.
Yeah,
Are we talking about things like telemedicine or community paramedicine?
potentially, yeah.
I mean, these things could really change the game when it comes to patient care.
They could. But it's important to remember that any deviation from those standard procedures
Mm-hmm.
requires ministry authorization and often involves specific medical directives.
So it's not just a free-for-all.
No.
It's very controlled.
Very controlled.
So they're exploring new approaches, but within this framework.
Yes, within the framework of the standards.
This is all so fascinating. It's incredible how much thought goes into creating this system that's both like structured but also adaptable. But before we go too far, I think we need to dive into the specifics of these standards a little bit more.
Absolutely.
Kind of see how they actually play out.
For sure. Welcome back to our deep dive, into the world of Ontario's paramedic standards.
Yeah, we've been talking about this balance between these really strict rules, but also that flexibility they need in real-life emergencies.
Right.
It's honestly amazing how much depth there is to these standards.
Yeah.
I had no idea there was so much nuance to this job.
Right.
I mean, it seems pretty straightforward on the surface, but
Yeah, you think so?
it's clearly not.
No, it's not.
So it really shows like how complex healthcare is and the dedication these people have to making sure they're doing things right.
Exactly.
So we talked about those paramedic shall
Mhm.
statements,
Mhm.
but I noticed the document also outlines specific guidelines.
Right.
So how are these guidelines different?
Okay, so
Because those shall statements sounded pretty guideliney to me.
yeah, I mean, they are guidelines in a way, but the document specifically differentiates between shall statements
Uh-huh.
and then what they call guidelines.
Okay.
So you can think of them more as like informed suggestions
Mm-hmm.
or expert advice
Okay.
based on experience and best practices.
So like a cheat sheet for trickier situations.
Yeah, exactly.
Like when those standard procedures don't quite fit.
Right.
Exactly. Okay. So are they like legally binding in the same way those shall statements are?
No, they're not legally binding.
Okay.
But they do provide crucial guidance, for paramedics when they're navigating these more complex scenarios.
So can you give us an example of like when a guideline might be useful?
Yeah, for sure.
Like what kind of situation are we talking about?
Okay, so let's say a patient is experiencing a very specific symptom,
Mm-hmm.
but it's not quite clear what the underlying cause is.
Okay.
So the standards might not have a shall statement.
Right.
That's exactly for that presentation.
So the guidelines kind of step in and say, hey, maybe try this.
Yeah, and they offer recommendations based on like the latest medical knowledge
Right.
and research.
Okay, so it's bridging that gap
Exactly.
between what we already know and then what's always evolving
Right.
in medicine.
Exactly.
And giving the paramedics those tools to make, informed decisions, even when they're not totally sure what's going on.
Yeah, when things are a little gray.
Yeah. So it's a lot like that escape clause we were talking about,
Yeah.
like recognizing that sometimes you just got to step outside the box.
You got to do what's best for the patient,
Exactly.
regardless of the strict rules.
And speaking of doing what's best for the patient.
Yeah.
Remember how we were talking about the definition of patient?
I did.
So it's not just the people they transport to the hospital, right?
No, so anyone a paramedic comes into contact with for potential assessment or care,
Mm-hmm.
that's considered a patient.
So even if they refuse treatment?
Even if they refuse treatment, they're still a patient in the eyes of the paramedic.
That's interesting. So it's not just about taking people to the hospital. There's this bigger kind of patient-centric approach.
Absolutely.
And I think you mentioned something about the patient priority system.
Yes.
What is that all about?
So it's a framework for managing the flow of patients
Okay.
and ensuring that the most critical cases receive immediate attention.
So they're making sure that resources are being used effectively.
Exactly.
How does that work, like on the ground?
So it involves something called bypass agreements
Okay.
that are integrated into an ambulance operator's deployment plan.
Bypass agreements. What is that?
So
That sounds pretty serious.
it could be, so basically, these agreements allow paramedics to make decisions about where a patient is transported to.
Okay, so are we talking about situations where a patient might be taken to a hospital that's further away, even
Yeah.
if there's one closer?
That's exactly what it is.
Wow, so it's not just about speed.
No.
It's about getting them to the right place.
To the right place for the right care,
Even if it takes a little bit longer.
even if it takes a little bit longer.
That's fascinating. So
Yeah.
it's a pretty sophisticated system.
It really is.
And it's all about making sure that those patients get the care that they need.
Yeah, that they get the best possible outcome.
So we've got the mandatory actions, those extenuating circumstances, those guidelines for trickier situations.
The expert advice.
Yeah. And now this whole patient priority system,
It's a lot to think about.
these standards are comprehensive.
They are very comprehensive.
But there's still more to explore, right?
There is.
Before we dive into the last little bit,
Yeah.
let's just take a second to reflect on what we've learned so far.
Yeah, for sure.
Okay, so we're back and ready to kind of wrap up our deep dive into this whole world of paramedic standards in Ontario.
Yeah, it's been pretty in-depth.
Yeah, we've gone through a lot, haven't we?
We have.
We talked about mandatory actions,
Right.
those escape clauses, which are fascinating,
Yeah.
those expert guidelines for those trickier situations,
Right.
and then that patient priority system.
Yeah.
Mm.
Who knew there was a whole system for like prioritizing patients and getting them to the best hospital?
Right, it's not just the closest one sometimes.
Yeah, exactly.
It's about appropriate care.
These standards are seriously comprehensive.
They've thought of everything, it seems like.
Yeah, they really have. And speaking of thinking of everything,
Yeah.
I wanted to circle back to something you said earlier about the role of research
Okay.
in shaping these standards. It's
Yeah.
not just about reacting to emergencies,
Yeah.
right?
Definitely not.
It's about like constantly learning and evolving as a field.
Absolutely.
So how does that work?
So the document really emphasizes that clinical research is the foundation for providing safer and more effective treatment.
Okay.
But then it takes it a step further and says that research protocols might sometimes require temporary changes to existing patient care standards.
Whoa, hold on.
Yeah.
So research can actually lead to adjustments in how paramedics operate in the field.
Yeah, in real time.
So they're not just studying what works.
Right. They're actually implementing those findings to improve care as they go.
Exactly. Yeah, it's all about staying up to date with the most recent evidence.
So like a new study could potentially change how paramedics approach a certain situation.
Yeah, absolutely.
Wow, that's incredible, the power that research has.
It is.
But how do they make sure those changes are made safely and effectively?
So any changes to the standards based on research,
Mm-hmm.
they're carefully reviewed and approved by the Ministry of Health.
Okay.
And this helps to strike that balance, between innovation and patient safety.
Right. So you want to move forward, but you want to do it carefully.
Exactly.
So it's a really thorough process.
That is.
Making sure that any adjustments are based on like solid evidence.
Yeah, and that they're implemented, in a controlled manner.
Yeah, it makes sense. It's all about progress.
Hmm.
But it's progress that's, guided by careful consideration and patient well-being. So we've got research playing this crucial role, but there's another piece of the puzzle we touched on before, and it seems so simple, but it's so important,
Right.
and that's definitions.
Yes.
Like just defining key terms to make sure everyone's on the same page.
Exactly. Consistency and clarity.
We talked about the definition of patient,
Mm-hmm. Very broad.
but what about paramedic?
So you'd think paramedic would be a simple definition.
Right, like what could be complicated about that?
Yeah, but the document actually goes beyond just, the basic definition.
Really?
Yeah, so it specifically aligns its definition of paramedic with the one in the Ambulance Act of Ontario.
So they're making sure that everything's consistent.
Yeah, with all the legislation.
It's like they're dotting every I and crossing every T.
They are.
This whole system is so well thought out
It is.
to ensure the highest standard of care.
Absolutely.
We've uncovered so much today.
We have.
It's really been incredible.
It has.
I've learned so much.
Me too.
But I think as we wrap up this deep dive, it leaves me with one question.
Okay, shoot.
How do these standards,
Yeah.
this balance between strict guidelines and adaptability,
Right.
how does that impact the relationship between paramedics and the communities they serve?
That's a really great question.
Because it's one thing to have all these rules and regulations,
Right.
but how does that actually play out in the real world,
Mm.
in those interactions between the people who need help
Right.
and the people who are there to provide it?
It really gets to the heart of what it means to be a paramedic.
Yeah.
It goes beyond just the procedures.
It's about that human connection.
Exactly.
Well said.
And it reminds us that, behind every siren, every flashing light,
Mm-hmm.
there's a whole world of careful consideration
Right.
and this really deep commitment to patient care.
Yeah.
So these standards, they're more than just rules.
Hmm.
They're a reflection of that dedication and expertise.
That goes into every interaction.
Every moment of care.
Well put.
Thank you.
And on that note, I think we'll leave everyone with that thought-provoking question.
Yeah, something to ponder.
So until next time, fellow knowledge seekers,
Diving deep.
keep exploring the world around us.